Hello everyone, I hope you guys are doing well. In this video, I would like to take a minute or two to show you how aerosolized secretions appear in cone beam CT scan. This patient had his or her scan taken in order to receive dental implant at the site of missing tooth number 14. That it can be seen in the axial, coronal, as well as the sagittal view. As I quickly scan through the ridge, and we can see that the height of the ridge and the shape of the ridge varies depending on which coronal or cross-section that you look at. Where we have significant or pneumatization of the sinus, the ridge measures short or shorter, and then as we go distally, the ridge measures taller. So that's something to keep in mind as you treatment plan for implant. But then I noticed in the patient's maxillary sinus that it's partially opacified. But as we look at these opacification, I noticed that this is something different or appears different from the typical mucosal thickening that we see very commonly in cone beam CT scan. From this sagittal and from other planes as well, we see these air pockets, right? It looks like a bubble. There are multiple well-defined circumferential radiolucencies that have the same density as the air. This portion of the maxillary sinus as well as this part as well. So these are what's called aerosolized secretions. And so again, let's verify that from the coronal view. So all these small multiple radiolucencies represent aerosolized secretions. And lastly, let's look at that in the axial view as well. While we're unable to compare this left maxillary sinus with the patient's right side, at least the integrity of the surrounding structures, the walls of the maxillary sinus, appears normal to me with no evidence of expansion or marked sclerosis at this point. So that's the aerosolized secretion and how they appear in cone beam CT. And I hope that was again educational, and I'll see you in the next video. Thank you very much for tuning in. Take care.